Welcome back to America Tonight. Very pleased to catch up with Dr. Russell Silverstein from Dallas's Nephrology Associates Nephrology. Now, that's a million-dollar word. You say that, and I know the doctor's going to tell me this. People don't know what it means, but it's very important because let me tell you, 1 in 10 Americans are affected and have to go to people like Dr. Silverstein, and a lot of times they don't get there soon enough, and the idea is to get ahead of that curve. And, of course, we're talking about the doc being a kidney specialist. Doctor, thanks so much for coming on America Tonight.
Thank you very much for having me.
Is that when you're like at a cocktail party and you say, you're a doctor of what? Nephrology. And then people kind of pretend they know what it means unless they have someone in their family who's been to a nephrologist in the past. Do you kind of get that reaction?
Yes, I do, because it's a mouthful of words, but it is very important. I'm a physician who assists in the management of kidney disease from many causes, predominantly diabetes and hypertension are what we most normally see as the reason that our patients have chronic kidney disease.
Yeah, how prevalent is diabetes? I mean, we keep hearing about all these studies, scary stuff, that people don't even know they have it. And, of course, we know some of the reasons, the eating habits and exercise and all of that. But have you, as a doctor specializing in this, have you seen that number shoot up significantly?
I have. Diabetes is the most common cause of kidney failure in the United States, and we estimate about 26 million Americans now are living with chronic kidney disease. And as you said, Kate, so many million more are even unaware that they could have chronic kidney disease and could be at risk. And the unfortunate thing is, as we grow older, the risk of diabetes certainly increases.
Yeah, so early detection obviously is important. What are some things are there signs, or are there something people can look for?
Unfortunately, initially, it is not detected unless you go see a physician and he checks your blood sugar, checks your blood pressure, and looks at your urine if there is protein. So protein in the urine is the earliest sign of kidney disease. And kidney damage, Kate, can be detected with an assessment of blood pressure, as I mentioned, along with simple urine and blood tests.
So when you, and of course, you have a group of associates who so specialize in this, and obviously the important thing is you're trying to help patients as much as you can. I would assume to partially avoid dialysis, because, that's what you think of in your mind, the worst case scenario. Oh my gosh, dialysis, which, of course, dialysis today versus what it was, I'm sure 40 years ago is very different. But do you get, when people come to see you and they find out, kidney problems, are they thinking that initially, do I have to have dialysis, and what is that?
Yes, absolutely. They're worried that they're going to need dialysis or even a kidney transplant. And if we can see these patients along with their primary care doctor and document that they have chronic kidney disease, we are able to help them. And the earlier we can detect that there is a problem, then we can begin assessing exactly what medicines that they need. We do know that African Americans and Hispanics are at a higher risk for chronic kidney disease. Obesity has been associated with a higher risk of developing kidney disease. And there are certain medicines that we can prescribe that will help preserve kidney function and reduce the progression of kidney disease.
Somebody asked me this the other day, so it was perfect that we were having you on the show. What's a kidney number? They said, check with your doctor, find out about the kidney number. What does that mean?
Well, those patients who are at high risk, and I think we've already discussed those, of developing chronic kidney disease, it is important that they know their kidney number, just as we all know our cholesterol level, and many men even track their PSA, or prostatic specific antigen level. So the kidney number is a measure of kidney function, and it's based on the amount of a substance called creatinine in the blood. Then we will categorize patients between 1 and 5 as what kind of damage that you have. Chronic kidney disease stage 1 certainly is better than chronic kidney disease stage 5. And we're able to help patients the earlier we can see these patients and help detect chronic kidney disease if that's what they have and prescribe an effective regimen for them.
Yeah. Now, let's say the worst case scenario, somebody has to have a kidney transplant, but then now we've seen, and you guys are specialists in this, we've seen the success, the lives that people have been leading with the kidney transplants. How much has that medicine changed? Because you guys have to be doing something right, frankly, doctor, because I've met a couple people that have had kidney problems, that have had severe kidney problems, that had to get a transplant. And it's amazing to me, I guess, as somebody who's not a doctor, to see how long they've lived and the kind of healthy lives they can live. Has there been vast improvements, it seems, in this area?
Yes, there absolutely has. These medicines work to reduce morbidities, that's complications of issues with chronic kidney disease, and certainly mortality. Side effects are much less than they used to be, but of course we want to prevent patients needing a kidney transplant or needing dialysis, and we're able to do that by controlling blood sugars and blood pressures as early as possible and putting patients on the correct medication regimen to help preserve kidney function and to keep that kidney number as low as possible.
Yeah, so we go back to that number, how important that number is once you know that, what you're looking at. The thing that we keep hearing, and I mentioned this just briefly, touched on at the beginning, is the whole thing about, obesity, this is causing the spike in diabetes. Is that true? I mean, is it the dietary changes? You've got to start making them little things here and there to prevent going down that road in the first place?
Absolutely. Obesity in itself can cause chronic kidney disease, and if you are overweight, losing just 10% of your body weight can help control blood pressure and diabetes, and that in itself will help preserve kidney function.
Ooh, 10%. There's people listening to us that are thinking, 10%, I know I can get there, doc. 10%, I can start with that. Because I think that sometimes before people make changes, they become overwhelmed with, oh man, I have such a long road to go. I'm just not, I think I'll start next week. I'll start the next week after that. You probably hear that from patients, don't you?
Yes, we do, and there's plenty of time. I mean, 10% may sound like a lot, but we have months to years to continue to reduce the weight by a good exercise program and a good dietary program.
Yeah. The across the board when we talk about kidney disease, what are the big age groups for kidney disease, or is it just across the board?
Kate, I take care of adult populations, but pediatric patients can have chronic kidney disease, and adult patients all across the board, from early in their teens to in their 90s. And the predominant reason is both diabetes first, hypertension second, and then patients who are obese can develop both diabetes and hypertension, and that's why weight loss program and exercise is so very important as part of your healthy lifestyle.
Yeah, absolutely. And with the hypertension too, is it what causes that? I mean, is that stress? Is that low sleep? Is that just a combination of factors?
We don't know why a lot of patients develop hypertension. Certainly it is in the family, but it doesn't need to be. Obesity will cause hypertension. If you have chronic kidney disease, a complication of chronic kidney disease can be hypertension, and diabetes can also cause hypertension. So all of these factors are so very important, and if your doctor would make sure that you're prescribed the correct medicines to reduce your blood pressure, control your diabetes, and preserve kidney function by the appropriate medicines, you as a patient will be so better off.
Dr. Silverstein, thanks so much for coming on the air. And now, thanks to you, I definitely can answer what a nephrologist does, by the way.
That's wonderful, Kate. Thank you for having me on the show.
Thanks for coming on. Bye-bye.
You're very welcome. Bye-bye.